I was invited, I guess as the CEO of Southern Hills Medical Center, to attend an event at Lipscomb University. It was basically called Opening Doors, an event to explore the opportunity of reaching out to the Latino population with all the different business and industries, and maybe that there was opportunities of bringing key leaders together to explore ways to improve access on multidisciplinary areas, whether it be banking, healthcare, or government.
That's good. And then, can you tell us about who you met or the other groups that were there, and how y'all's conversations began?
Sure. We, at the Opening Doors event, after we had conversation around the global issues that are affecting Nashville and Davidson County with regards to the Latino population, we broke out into service line sector breakout groups. I was one of the only hospitals represented there and was a member of the healthcare breakout group. At that point, I had the opportunity to meet several individuals that were also working within Nashville and Davidson County in different avenues. And I truly believe that this was the synthesis of what we ended up creating, is that real grassroots efforts of getting people with common goals and common missions in a room together, and really having people that could make decisions to sit down and talk about the issues and the opportunities and how you could work together to achieve results.
Yeah, gentleman just walked by.
Oh no, that's fine. I mean, I'm not trying to fool anybody. That's
Okay, all right.
And from your perspective and with your degree of expertise, what would you identify as the barriers or access issues that do face Latino populations or service providers operating in Latino-based communities?
Right. One of the things that I've had the opportunity to experience in my career in healthcare is that many times our emergency departments at our hospitals become access points. I'm just going to wait. And those emergency departments become access points for people. When those emergency departments are utilized for emergent needs, those are very appropriate needs. We have the resources and the capabilities to take care of the immediate need in those patients. The problem is that many people utilize emergency departments for primary care needs. And while we still see those patients, we typically are only able to treat the acute needs. And then in most hospitals, a referral is typically made to an outside primary care clinic. And in my experience, that's where you see a lot of primary care not being met. People aren't able to follow up. They aren't able to find the clinic. They aren't able to make that connection for that continuum of primary care. So one of the opportunities as a hospital, knowing that you are an access point, knowing that people are going to be drawn to you, are going to come to you, is there an opportunity to work or partner with other organizations to provide access?
Would you identify or would you even want to elaborate on any of those issues, like specifically as they relate to the Latino community?
Typically, here in South Davidson County, where Southern Hills Medical Center is located, we have probably one of the fastest growing Latino populations. Culturally, and without stereotyping the Latino population, this is a group of individuals that typically are hesitant about healthcare. A lot of them don't believe in carrying health insurance. This is all based on culturally the way they were brought up in their own country. A lot of these individuals don't seek out preventative care. So typically what you see is a lot of acute issues and acute illnesses. Gone unmet lead to further disease and more chronic disease, heart disease, diabetes, obesity. All these are opportunities that we can make a difference on, and we can proactively reach out to this group of individuals as well as any group of individuals to provide these basic primary care needs to improve the overall health of the community.
I've got a question.
Yeah.
Or do you have one more?
I got lots.
Oh, you keep going.
No, tell me what you got.
I just want him to reference Lowry.
Oh, we'll bring it back around. Yeah.
You're up now.
Tell me about your meeting with Pam. Was it Pam from, like, and just like as conversationally as you want, about how that came about, like when it sort of clicked for you, wow, we can do something. Tell me about how that happened.
When I was sitting in the breakout session at Lipscomb University, and I believe I was actually seated next to a lady named Pam Brillhart. Pam is one of the directors of United Neighborhood Health Services. And as we exchanged business cards, I basically asked Pam what she did, what her organization does, and where their clinics were located. And at that point, we basically almost simultaneously said, you know, there's got to be something we can do. There's got to be a way to get at this issue and this problem. And so when I left that meeting, I had Pam's card in my pocket, and I came back and I started thinking about really the issues that have troubled me throughout my whole career. And now knowing that I had this new friend and this new contact who seemed eager to get at the solution, you know, it really gave me an opportunity to reach back out and say, hey, let's get serious about coming up with some solutions to this problem. And from our standpoint, to me, that solution was an easy one. You know, if I was able to grant access on campus to this organization and do it at a low-cost avenue, would that be attractive to them? And the answer was yes. And so what we were able to do is we provided a in-kind lease agreement to United Neighborhood Health Services, basically gave them free rent to be in one of our medical office buildings, which gave them the ability to come and set up their primary care clinic here, basically with us helping subsidize the operations through the rental arrangement. What that gave to our community was a primary care group of providers that had the ability to provide access to uninsured and underinsured individuals right on site without having to go to a different clinic location across town or search out a location to be found. Also, you can refer to these type clinic as a cash clinic. The Latino community believes in paying for cash, paying for the services they render right away. That's typically part of their heritage and how they believe, and so this gives us the opportunity to reach out to them as well and provide this service to them. The clinic operates on a sliding scale basis, so we believe we're able to reach a huge population and make a difference. Now you guys will like cut and paste pieces of this, right?
That's why I would think of something else we want to talk about. If you were talking to a group of people, a committee, or a CEO of another hospital about to give advice about doing this, and would you do it again, and here's some things to consider, what kinds of things would you tell them if they were looking at a solution or looking at ideas for a solution for their communities?
I think many hospitals are faced with the problems of inappropriate access into an emergency department for non-acute issues, sometimes being overrun by non-emergent needs, and I only see that getting worse over time. With 50 million Americans uninsured right now, access is a huge issue. For us, this has been a great solution, one that we feel really follows the mission of our organization. Our mission is, above all else, we're dedicated to improve the human life. By having this, and by having this partnership, we are able to provide that access for preventative care. So hopefully we're able to get people working towards a treatment plan that will ensure that they don't end up getting chronic disease in one of these other categories. What I would tell fellow hospital CEOs that are looking for options, looking for solutions, look within your given community. Look to partner with organizations that are already doing the work. Quite possibly it's being done right now, and like here in Nashville and Davidson County, simply by pooling our resources and partnering, we were able to achieve great results in 8 months. So what takes some people years to figure out, waiting on healthcare reform from the federal government could take years for it to finally come down. We basically got together, rolled up our sleeves, and said we want to be part of the solution.
I got one, John. And you look at Jonelle when you answer.
Sure.
How does it feel for you personally when you know you're responsible for healing families and families that come in here who couldn't get help anywhere else? How does it make you feel when you know you're making an impact in a not only a person's family but their whole community?
Well, I can tell you that I tell a lot of people, and I have the opportunity to work in a field that I think is one of the most blessed fields out there. I also think it's one of the most difficult environments to work in. I meet with every new employee that comes into this organization in orientation, and we all talk about the fact that healthcare is tough and healthcare is hard. But I really believe that people enter healthcare for a reason. And I surely know the people at Southern Hills Medical Center are in healthcare for a certain reason. And I don't just mean doctors and nurses. I mean administrators, and I mean housekeepers, and I mean people that are working in our cafeteria. Predominantly, the people that are drawn to healthcare are the people that want to help, and they want to serve people. It's part of who they are. It's innately part of their makeup. And so coming up with ideas that are creative and coming up with a solution potentially that could change the course of someone's life for the better is probably the most rewarding thing that you can do. I tell everybody that comes to our hospital, there are bonuses to be made at Southern Hills Medical Center, and they far outweigh monetary bonuses. And these are the bonuses of when a loved one comes up to you and embraces you and thanks you for saving their husband's life, or a mother comes up to you and wraps her arms around you and cries because maybe we didn't save her daughter's life, but we were gracious when her daughter passed away. These are the bonuses that I believe that people get tremendous payback from. And so it makes me extremely proud to be part of an organization that believes this in their mission and is courageous enough to step out and try to do something a little different to further the efforts of our own community.